Hello, Danvers. Thanks for tuning in today. This is Senior Solutions, and I'm your host, Karen Halloran. And today we have on the show Dr. Wayne Saltsman. He is the Chief Medical Officer and Hospice Director for All Care VNA. And we also have Stephanie Abbott, Director of Business Development for All Care VNA and Hospice. Thank you for joining us today. It's so good to see both of you.
Great to be here. Thank you.
And thank you for having us this morning, Karen. As you said, my name is Stephanie Abbott. I'm the Director of Business Development with All Care VNA and Hospice. All Care is a standalone, nonprofit home health agency that's been in existence since 1911. That's over 100 years, Karen.
Wow.
Yes. So we provide skilled nursing, physical therapy, occupational therapy, and home health aid services in the home. We also provide private care in the home that includes home health aid services and homemaking services. And we also have a palliative care program, a hospice program, and an adult foster care program for patients that are on Mass Health.
Oh, thank you, Stephanie. That's really a lot of stuff that you do there.
Yes.
Now, Dr. Saltsman, do you want to tell us about what serious illness care is all about?
Yes, and thank you again for letting us come in today. So, serious illness care, it's kind of a scary term when you think about it, but it's a term that we are using to really explain the type of work that we do at All Care and that people are doing all over the country, talking about advanced care planning, palliative care, and hospice care. And that's what serious illness care is all about. Of course, you're going to ask me, what is serious illness? And so it's important for people to know that, when you go to the doctor for a routine checkup and you check out okay and you leave, that was preventative or routine care. When a doctor says, you have a medical issue, high blood pressure, diabetes, etc., and you've had those things for a while, those become chronic issues. And when those issues interact with each other, you may be a little bit more complex than you were when you were just doing routine care. Serious illness is when one of your chronic problems or a new problem becomes so significant that it may be life-determining. And so serious illness is actually a whole new type of care which we really need to think about uniquely. And fortunately, there are professionals, both physicians and non-physicians, who are specialized in helping to manage serious illness through palliative care and hospice.
Well, let's back up right there.
Sure.
What is palliative care? Because I know a lot of people are questioning that. Is that a new term?
It's not a new term whatsoever. In fact, it's been around probably for more than 25 years. And I'm so glad you asked the question, because even my own colleagues, when I say, perhaps your patient could benefit from palliative care, they say, oh, no. Not time for palliative care yet, which leads me to believe that they're confusing palliative care with hospice. So when I think about palliative care, I think about it in a way, this is how I explain it to folks. If you have a heart issue and your primary care doctor needs more help understanding your heart, you are referred to a cardiologist. And the cardiologist actually is an extra layer of support for you and your primary care doctor to help take care of your heart. Okay, well, let's say that you have a serious illness, whatever that serious illness might be. And who do you turn to help manage the serious illness? The symptoms, the quality of life, the questions that come up, the education. Who provides that extra layer of support for you as a person dealing with your serious illness? The palliative care team does. So when we think about palliative care, we're thinking of that extra layer of support for folks who have serious illness that your primary care doctor or even a specialty doctor can refer you to for a specialized team approach, that specialized team of physician like me, nurse, social work, chaplain, to provide that mind, body, spirit, holistic care. That's what palliative care is. And the thing is that while you're getting palliative care, you're also having the same care that you've had. So your serious illness, whatever disease process that may be, it's still being managed. And you're providing additional care to the person to manage symptoms, make sure that quality of life is as good as it can be, holistic care around the additional care that you're receiving anyway. Extra layer of support.
That's a great, great service to people. I've heard a lot of times, though, you had mentioned doctors are hesitant to, request that palliative care. People can miss the boat on that. So it's really important to get the word out, I think, about that.
The earlier, the better. And once again, even my own knowledgeable colleagues are confused sometimes between what is palliative care and what is hospice care, which I hope we'll be able to talk about briefly as well. But the sooner someone can get onto palliative care, the sooner symptoms are managed, the sooner anxiety about illness or about what's with my family or what does my future look like or how do I manage things today can be supported, and education about what are the next possibilities also can come into play. So we want folks who have serious illness, who can benefit from palliative care, to get that as soon as possible. And like I said, there are plenty of folks in the community that provide that. All Care happens to do it. We do it wonderfully, I might say. And we do it in this town.
That's great. I was just thinking, though, too, what about advanced directives?
So I'm so happy you mentioned that. I think what it boils down to for me, and what folks don't realize, is that you have a choice in your care. You always have choices. And you should have discussions with your physicians, your primary care doctor, your specialty physicians. What does my disease process mean for me? What do these medicines mean for me? What do things look like down the line, so that I can be informed and I can make choices about my health care? It's always about choice. So what happens if I am not able to use my voice to make that choice, for whatever reason that might be? I am not able to tell doctors or my loved ones what my choices are. What do we do? So we want people to talk with the folks that they love and the folks that they trust about what their wishes and choices are. In doing so, there's always somebody, my wife, my best friend, whom I trust and who know what my choices and goals are, and who can be my health care agent or my surrogate should I not be able to voice those things myself. An advance directive in the state of Massachusetts is a healthcare proxy. The healthcare proxy names who that healthcare agent, that person that I trust, who can talk about my choices, my wishes, should I not be able to. A healthcare proxy is so important. And what we know is that the majority of people in our communities do not have somebody that they have said, I want you to be my voice if I cannot use my voice, who understands my choices and my values, and how I've identified on this healthcare proxy. So an advance directive in the state of Massachusetts is a healthcare proxy in which you have named a healthcare agent, and also an alternate you can name, to be your voice should you not be able to express it. I cannot tell you from a doctor point of view how important it is to have someone to turn to who can be someone's voice should they not be able to express it themselves. It's all about choice. You have the choices to do that.
And if somebody's putting that in writing, there's no question if they become incapacitated. They don't have to guess, would mom have wanted this? Would mom have wanted that?
And that's why I say it's important for us as healthcare providers. We need to know, because if we don't, we are going to default to what we have been trained to do. And those things may not be what somebody wanted us to do for them. They may not want certain services that we would by default provide. Details not important here, but we want to make sure that we are taking care of folks in accordance with their choices for care. Be informed, be educated, communicate, have choices.
That's really a lot for people to do. They need to do that.
Please.
Okay, let's back up for a minute. We had touched upon what is the difference between hospice and palliative care?
So, thank you. Thank you for asking the question. It's something that Steph and I and our teams try to explain all the time. So, palliative care, as I said, someone has a serious illness and a specialized team provides that extra layer of support. Hospice care is a form of palliative care. Same specialized team, same layer of support. The difference is that now we know that someone has is at end of life. Not immediate, but we know they're on the trajectory towards end of life now. Palliative care, they don't necessarily need to be. But with hospice care, we know that folks are on the trajectory towards end of life. Hospice, unlike palliative, hospice separates out the disease from the person. We no longer are focusing on managing the disease, the serious illness. Now we're only focused on managing the person. How do we help the person be as comfortable, safe, supported, qualitied for whatever amount of time they can be? How can they be the best that they can be for whatever amount of time? And people have a difficult time with that. Well, wait a minute. Does that mean you're not going to check blood pressures and you're not going to check blood and you're not going to do this and do? We are only now concerned, as the hospice philosophy goes, we're only concerned about the person, not the disease. Palliative care, the person with the disease. Hospice, the person. And so you have a specialty team now that wants to help someone be at home if that's their choice to do so. And by the way, hospice and palliative care, choices, all choices. Want people to be at home, be safe and supported. We also support the caregivers and the families, crucial, in order to make sure that people can be who they want to be recognized as being and be valued for whatever amount of time they have left. So, does that make sense?
It does. It does. I think one thing, too, that you just touched upon is how helpful it is for the families. The families really get the support they need. I know we've used hospice in my family. What a wonderful experience we've had.
Oh, I'm so glad. I'm so glad to hear that. You know, I came to see a lady in her 90s who was truly at end of life, and her daughter said to me, you know, I didn't realize that mom was dying. I just appreciated all the services that hospice brought in.
Right.
And so people think of hospice as being services. Well, hospice, because we're focusing on the person at this very special, unique time that we call end of life, we want to be able to bring the most amount of services in as possible to help support people. So hospice brings in the services, and hopefully the result is quality end of life care, not requiring the emergency room or the hospital, and people have their life trajectory the way they want it to be.
There's a lot of myths and misunderstandings when it comes to hospice. I've heard you can actually graduate from hospice. That does happen from time to time.
So there are a lot of rules around hospice. And we find that when that specialized team comes in to help support folks, that they actually begin to thrive with the extra support that they receive. And hospice is about understanding that people will decline at end of life. Sometimes people thrive and they actually become much more stable, and they actually are doing well. So they may not qualify for hospice right then and there, and so the term graduate is often used. But we know those people will maybe come back onto hospice again.
Right.
But the myths are that someone doesn't have to be imminently dying. We don't take away all medications. You know, things like that. You know, people can go to the hospital. At the end of the day, the myths can be busted if we understand that these are all choices people are informed about and educated about to make about the way they want their lives to be.
great.
Dr. Saltsman, I just wanted to add that it's so important to talk about hospice and help patients finish their story. We don't talk about hospice enough, but we're all going to need it at some point. So it's just really important to, have these conversations and talk about it with our families.
Call us. If you have questions, call us. Let us talk to you. Let us help.
And how would they do that, Stephanie? Would you like to tell us how, if somebody would like to get in touch with you, how would they do that?
Well, I'd absolutely like to share with you my cell phone number to call, 339-440-0136. That will come directly to me. But the main number of All Care, 781-598-2454.
24 hours a day, 7 days a week,
Oh,
365 a year. Hospice is important. It's really important. We have to be available to people all the time.
Yeah, so even if it's a holiday, you're still working.
Yes.
Absolutely.
Okay, so to wrap up the show, I'd like to ask 3 questions at the end. Don't be afraid. The first question is, tell us a fun fact about you. It can be anything.
I love to bake, cook, and garden. So I took up sourdough baking. Steph doesn't know this. I took up sourdough baking during the pandemic, and I still do it now. And I love making sourdough, especially for my my older adult neighbor who says, "Wayne, when are you going to make me another one of those loaves?" So that's my fun.
You
fact.
could have brought one today.
I could have. I'm sorry.
Stephanie?
So I guess my fun fact is I am a dance mom and I'm a hockey mom.
Oh, wow. That's great.
Yes.
All right, the second question. We love pets on the show. Do you have any animals?
We have a 13-year-old puggle named Ellie.
Oh.
We have 3 cats. Bridgeton, who's a rescue that we got between Bridgeton, Maine and Freiburg, Maine. So she's Bridgeton Fry. We have another rescue cat named Cotton O'Cotton, who's 25 pounds.
Wow.
And we love ragdoll, the breed ragdoll. So we have a 3-year-old ragdoll named Nitro Blue.
Whoa, what interesting names. I think I counted 4.
4 pets altogether.
Okay. Stephanie, do you
And-
have any pets?
We do. We have the sweetest mini golden doodle, and his name is Sunny D, and he's 4 years old.
Oh, I love golden doodles. Now, the final question. Summer is here. Yay! Do you have any summer vacation plans?
So we are fortunate to have a lovely little place in Maine on one of the southern Maine lakes. So and it's only 2 hours from the house, so we're able to go there on the weekends and hang out. And that's where we experience, actually all year round, but we experience the best of summer.
Oh, that's fantastic. Stephanie.
Yes, and in August, we are taking a week family vacation right on the beach in Wells, Maine.
Oh,
nice.
nice. I love Wells Beach.
You'll be an hour from me coming
Yes,
up.
okay.
Well, I'd just like to thank you for coming on the show today. It's been very, very informative information. I'm sure everybody out there will get a lot out of this show.
Oh, I hope so. Thank you so much
Thank you,
again.
Karen. Thank you so much.
And thank you for tuning in today. Until next time, have a great day.